now, the main event, today's presentation. And with the introductions, here is once again Ivar Shaki.
Okay.
Thank you, Mr. President. It is a great pleasure to introduce our speaker, prime speaker of the day, Dr. Arturo Cervantes Trejo. And Dr. Cervantes is a medical doctor with a master and doctorate degrees in public health from Harvard University. He is chair of public health at the Anahuac Institute of Public Health. And he has been in charge of the National Center for Injury Prevention in Mexico and is a founding member of the Forum on Global Violence Prevention at the National Academies of Science, Engineering, and Medicine in the United States. I think this gives you an idea of this is a professional that we are going to listen to today. Dr. Cervantes also brings with him two colleagues that he is going to introduce to you, but I now turn the words to Dr. Cervantes. Please come forward.
Thank you much. It's a pleasure for the Anahuac Institute of Public Health from Anahuac University and for the Faculty of Health Sciences to be with the Rotary San Miguel de Allende Midday Club. And it's an honor because also our motto and our logo at the university is Pinch in Bonum Malum, which is defeat evil with good. And I'm glad that we are all working towards doing well in the world and to changing life. And we are all honored who invited us for this brief presentation on COVID pandemic update. My name is Arturo Cervantes. I have been introduced, and I will be introducing Dr. Alejandra Cortés Rodríguez and Dr. Víctor Andrade, which will also participate in this update that we have prepared for you at the Rotary San Miguel de Allende Day Club. So let me start. This is our team, and I'm gonna briefly tell you what we've been working on for COVID. I don't know what that is on the screen, or one that I am watching, but somebody's drawing on the screen and I cannot control it. The Anahuac Institute of Public Health started with this observatory. Our observatory is composed mostly of medical graduates from the university. You are watching them on the screen. And what we did first, the pandemic emerging, we began to review the literature from throughout the world. And this literature was some presentation. I'm very sorry to all of you. So we created this observatory. The observatory had to do with the literature from all these sources, putting it together in Spanish and in items for distribution throughout the world. That was one of our activities, as well as modeling the epidemic. Ronald, is there anything?
No, I'm trying my best, but
people who are.
This means that there's someone, if you give us a moment, we can look through and remove whoever's there.
Let's try to.
It says Christopher.
How about this? Anyone that is on the call that wants to be and needs to be identified, we're going to need to see cameras open. Every camera that's shut, we're going to have to remove the caller.
Okay.
Okay.
We're going to
Go
stop.
ahead.
We're going to stop sharing the screen for a moment.
Yeah.
Doctor, you need to just unshare for a moment. Okay. All right, then reload it and see if we can continue without it being. Oh my.
Yeah.
Okay, there we are. Thank
I'm
you.
sorry, one second, doctor, one second. Yes, we can hear you. 1 second, please. Ron,
Yes.
Joey Merrifield is trying to get in.
Okay.
I see her. I'm gonna go ahead. Thank you. Thank you, doctor. So sorry.
Oh, God. He's frozen. Dr.
Okay.
Cervantes?
Can you hear me now? I know you. Yes, I'm here. Can you hear me?
Yes, I
We
take
can
it.
hear you.
We can hear you, we can
hear
see you.
But we can't see you right now.
Oh, I can see you.
Okay, so I will continue now.
Yes.
You are watching my screen, correct?
No, we had
Is-
somebody
no.
hijack it.
Okay,
No,
so
no, we don't have yours.
our team at Anáhuac University began to create this observatory in order to understand the progress that was happening throughout the world in terms of the COVID pandemic. And we also began to put together a group of people for tending clinically to some patients on a primary care basis. And let me mention that we're distraught by the fact that the government of Mexico guidelines for the treatment of COVID was to send people home, only acetaminophen to control symptoms. And given this, we began to do some research on the subject, understanding all the evidence-based surrounding different medications and different things. So our group has put together for you, and I'm going to pass the voice to Dr. Alejandra Cortés and Dr. Víctor Andrade, this update, which we'll hope will be useful. And we are attempting to respond to some of the questions that the San Miguel Rotarians made to us beforehand, and we hope that it is useful. We will also share the presentation with you, which has extensive links for further information on any subject. So Ronald, please allow Alejandra right now to speak, and I will be mute. She will be bringing the narrative as of now.
All right, it's going to take me a minute. This is complicated.
Alejandra Cortés.
Yes, I know. I'm trying. Nori, maybe.
I found her.
Okay.
Alejandra, I've asked you to unmute and then you'll be able to. There you go. Thank you, Alejandra.
No, thank you. Can you hear me?
Yes.
Okay, well, first of all, good morning, and thank you so much for having all of us. I'm going to start talking a little bit about the background of the COVID-19 pandemic. So first of all, as we all know, it started in Wuhan, China in December of 2019. It started happening due to human and animal interactions, not unlike what we saw with the influenza pandemic in 2009. And it was associated with the Hunan seafood and animal market. Back then, when it was first found out, it was originally called the novel coronavirus 2019, but then officially it became known as the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Can you turn to the next slide, please? So briefly, I just wanted to show everybody how it is that the virus works, because thanks to us knowing how it works, it's that we are able to know how to tackle it via the vaccines and also with the medication. So first of all, the SARS-CoV-2 virus enters the cells in our lungs using a spike protein that is shown here with a blue dashed circle. And it is going to join the ACE2 molecule that I drew there, and it helps carry the virus inside of us. So this molecule, ACE2, is found in special cells within our lungs. They're only found in our lungs, right? So they're also involved in raising our blood pressure. At the beginning of the pandemic, I don't know if some of you remember that there was a lot of about whether or not people would specifically taking certain medications such as captopril or valsartan, whether they would have a different outcome if they were to get infected. So fortunately, large studies nowadays have proven that even for the people that take these medications, they don't really have an increased risk of either getting the virus or of dying from it. So what's important about the structure that I'm showing you of the virus is that precisely that spike protein that we can see in the picture, that is what the vaccines tend to tackle, and also that is what such new medications, such as one called bamlanivimab, work by preventing the spike protein, which we see there, from binding to the ACE2 cell. So this is what's important for you to know. Basically, that is what we're tackling. Can we go to the next one, please? So many of you have probably read in the papers that there have been new mutations. So what's important to know about this is that we already know from beforehand that the virus tends to mutate about once every 2 weeks. So this is nothing new that we've discovered. The first mutation that started causing kind of a buzz in the news was the UK strain in November of 2020. Why? Because we found out that it could be transmitted more quickly than other strains. And so this means that it's easier to get it. So despite all of this, we don't actually know of these strain if the vaccines will work against it, if it will increase the risk of death, or if the illness is going to be more severe. Therefore, there's actually not much that we can do right now except keep investigating. A part of this UK mutation, there has also been a new one in South Africa that was described by the CDC on the 18th, on the 18th of December of 2020. And there's also another new mutation in Nigeria. So what are the risk factors for developing a more severe course of the disease? These are being over 60 years of age, having hypertension, especially if it's not well controlled, having diabetes, heart and lung problems, obesity, and cancer. So far, what has been shown to be the most problematic is having diabetes and having obesity. The rest are still important risk factors, but the most important ones are those that I mentioned. As for the symptoms, as you can see, fever, a cough, a headache, losing your sense of taste or smell, a sore throat, diarrhea, it all sounds very, very unspecific. You can also have it in all kinds of diseases. So that is why I put together one small table in order for you to be able to differentiate a little bit the different types of diseases and how similar it is, so that you don't really always have to worry when you start showing, for instance, a dry cough, or when you have nausea or diarrhea. So it's always about putting together all of these symptoms. So can we go to the next slide, please? So as you can see, there are 3 common viral diseases that I wanted to talk about. First, it's the flu, then it's the COVID-19 pandemic, and also the common cold. So the common cold is usually caused by a virus called rhinovirus. However, there are other coronaviruses that can also give us the common cold. So the coronavirus, it's not that it's the first time we're seeing it, is that it's this kind of coronavirus that we're seeing for the COVID-19 pandemic, which is caused, as we mentioned, by the SARS-CoV-2 virus. And as for the flu, it's caused by the influenza virus. As you can see from the symptomatology, it's all very similar. There's a cough, a headache, fatigue, a runny nose, a dry cough, fever. So it's all very similar between the flu and COVID-19 especially. But with the common cold, having a fever is very rare, and also sneezing is a little bit more common in that than in the other kinds of viral diseases. But what is a little bit more characteristic of COVID-19 is that there is a change in or a loss of your sense of smell or taste. So this is something that can also happen, for instance, when you have a very congested nose with the flu or COVID or the common cold, but it's something that we've found to be a little bit more predominant in COVID-19. Can we go back, please? And then as for the transmission, something that is very, can we go back one slide, please? There, thank you. So for the transmission, what's important is that why is it that we are insisting so much on the masks? Well, because it also has a transmission that is via respiratory droplets. What does this mean? When we talk, when we sing, when we breathe, we are letting out these very tiny droplets of our saliva that is going to be able to be transmitted to other people. So what happens is that we remain infectious for a longer time and it is more contagious. So for other diseases such as the flu or the common cold, it might need a little bit more of a direct sneeze or having a longer kind of contact. But with COVID-19, because of its easier transmission, that is why we are worried and we want to have a very controlled environment. As for the vaccines, as we all know, the flu vaccine, we all get it once a year. And the common cold doesn't actually have any vaccines, despite the fact that it's so common. So for the COVID-19 vaccine, we're going to talk a little bit about that in a little while, but it's important to know that the trials are still ongoing. And we also have to take into account that when we are asking for the vaccine to have the most amount of efficacy possible, we should also remember that the influenza virus vaccine only has over 60% efficacy. So it's not really something that is commonly seen to have a vaccine with 100% efficacy. So it is important to take that into account. And also because we don't really know yet how often we're going to have to receive the vaccine in the future. Now, can we go to the next slide, please? As for the treatment that is at home, it's mostly symptomatic. By that, what I mean is that if you have a fever, you control the fever. If you have a dry cough, you take something for the cough. It's all going to be very much so directed towards what symptoms you have. Now, one of the things that have been developed only for at-home treatment, not for in-hospital treatment, is called monoclonal antibodies. So this is what I was talking about the kind of medication that went specifically against the spike protein that is called bamlanivimab. So what it does is that it's going to help you make the course of disease a little bit less severe. So if I'm not quite sure yet if it's already within the Mexican market, but if you do get it, it's because your doctor thinks that you might have a tougher course of the disease and they want to make it a little bit lighter on you. And the only other thing that I wanted to mention right now is that as of today, there are about 89 million cases confirmed around the world of COVID-19. And there's about 1.9 million deaths confirmed so far about the disease. So this makes it that much more pressing for us to know. Another thing is that one of the things that I'm commonly asked is how long will my defense system, will my immune system work against this disease? So far, the easy answer is we don't know exactly. So a Korean study used 3 commercial kits, and they saw that patients assessed 8 months after infection of these, from 69 to 91.4% still had positive antibodies. But however, this was a small sample of patients, so we don't really know that we can generalize this for a bigger population. So what does this mean? That for these patients, most of them still had some protection against a reinfection from the COVID-19 infection, but it's still a very small sample. However, in a bigger US study, what we saw was that 40% of patients' antibodies had disappeared already in 2 months. But for the rest of the people, their antibodies were still stable from 3 to 9 months after that. So we don't know exactly how long, and we don't know if these antibodies are going to protect you from the new strains. So this is something that is still ongoing, the investigation. And as I mentioned, as of today, it's about 89.4 million cases and 1.9 million deaths so far due to this pandemic. And now I pass on the word to Victor. Thank you.
Give us a
Victor
moment.
Andrade,
while
Ron, please.
Okay, Victor, I just sent you, so you can unmute yourself. Thank you.
Thank you, I'm ready. Okay, good morning, everyone. Thank you, Dr. Cervantes and Dr. Cortés for that great introduction. So now we're going to talk about a thing that is called excess mortality. So based on previous data on the years before the 2020, the expected national deaths for 2020 was 600,000 approximately. And due to the pandemic, the deaths we actually saw in 2020 were 200,000 more deaths. So that's particularly interesting because it talks about there is something among us that is killing more people than we expected. Next slide, please. This is rather important because when we see the excess mortality going up at such a high rate and we don't know why, there's only one answer. For the people that don't believe that COVID-19 is a real thing, we have the numbers right here. And we took this image from the health ministry in which we can compare Mexico City and Guanajuato. You can see the red squares, which is the more excess compared to expected. This is totally in line with what we've seen because earlier in the year in Mexico City, we have more cases or more deaths because we are highly dense population. But then as you go over on the year, you can see that Guanajuato, that began yellow, it turns red around the 30th week of the year. So that talks about the travel speed of the disease from the center of the city to the cities around us. Next slide, please. Now, this table is really interesting because you can see the COVID-19 in Mexico registered deaths and the difference between the previous years and 2020. One thing that you may notice is that in Chiapas, the difference is lower. This is because Chiapas is a state with very low income and it's a very poor state. So probably what happened there is that there were more people dying than they could register or take care about. So that's probably why Chiapas percentage went down. But as you can see, many of the states went really high up. You can see Guanajuato, it went up 10%, which is really concerning for a state that has a really low population. So we have to take that into account. Next slide, please. Now this graphic is really dramatic. You can see this is from the health ministry. You can see that on the previous years for Guanajuato, the deaths were really having a same pattern. But once you turn out to the deaths that we're having in 2020, there is a really concerning spike. I mean, you can see it in your screen. It went up like more than half of the graphic. And this is really concerning because it talks about how easy it is for people to die. And we have to take into account that Guanajuato has a population that characterizes itself because of having really senior citizens. So this is concerning because they are the most vulnerable after the first line workers. Next slide, please.
Ahí
Now,
está.
thank you. We're going to talk about face masks. Just as Doctora Alejandra mentioned, to get COVID, we have to inoculate ourselves with a certain amount of viruses. Now, if we are in a closed space, we are expected to have a face mask on us. So that prevents the amount of particles from entering our nose. Now, the more we are in a closed space, and especially if we don't have a face mask, the amount of viruses that may infect us is going to rise. So this is one of the main recommendations, that even if you are in the supermarket or wherever you are, you have to use a face mask to prevent the number of infectious particles going into your body. Next, please. And that's going to be a very important thing for the next year. Now, prevention, just as I mentioned, the face mask can prevent up to 70% of high-risk transmissions. This is something that arrived to stay. I mean, throughout the year and the next year, we're going to be expected to wear it everywhere we are. Now, the recommendation you see in the portal box is because for the babies that are smaller than 20 years old, they are touching their face all the time, and they don't understand really what the face mask does. So in their cases, their first recommendation is to stay at home. But if they have to go out, they don't have to wear a mask because it could be dangerous for them. Also, social distancing is crucial for the particles that I've just mentioned to stay away from you. And you have a double barrier. The first line of prevention is the social distancing, and the more important defense you have, as I've mentioned before, is the face mask. And you should avoid crowded places like restaurants or bar. And maybe if you have to go to work in a public transport or subway, stay there as minimum time as you can. And if you're gonna have a gathering or something that must be happen physically, you have to choose outdoor locations with more ventilation while keeping social distancing and face mask. Next, please. Now, you do have to use non-medical disposable mask because there could be short of masks for the medical personnel. You have to wear it correctly while covering your nose and your mouth and your chin. So there's your safe area. You have to get 2 or 3 layers, and the best fabric for this is cotton and cotton blends. Now, what you don't have to do is something that it's hard for you to breathe. I mean, if you have a plastic something without correct ventilation, you could have it could be hazardous. Also, if your mask is loose, the point is lost because air can come in. One layer isn't enough. The exhalation valves are dangerous not for you, but for the people around you, because if you are infected and asymptomatic, you could be transmitting the particles through the vent to the people around you. Now, scarves, they are not a great material or fabric. And if you do use face shields or goggles, make sure you use them. But first, you have to have a face mask on. And please don't reuse disposable masks. Now, for the disinfection products, you can find these here in Mexico or in United States. You have Lysol or Clorox wipes. These are commercially available pretty much everywhere now with the popularity of these products. And depending of if you are at home, in your office, or the kind of surface that you're trying to disinfect, you can choose from these products. But pretty much you have to trust in the big brands because they are the ones that are more proven to be disinfection. Next slide, please. Now, for at home, taking care at home of yourself, you can see the pearl box that says SteadyFlu. This is an antiseptic solution that you can just spray into your nostrils, and it kills every bacteria and virus that shouldn't be there. And other evidence that we've seen as part of our review is that things like the orange box that says Estericide and some mouthwashes The recommendation that we found is that you should do gargles with these substances for at least 30 seconds to kill the virus and bacteria that might be lying on your pharynx. Next, please. Okay, so now we're going to talk about the vaccine availability. Okay, so from December to the next February, the Mexican government has contemplated the frontline health workers. Supposedly, it's going to contemplate public and private sector physicians that are on the front line. Then we have other health workers that are not in the front line, and the population that it's 60 or plus. Then starting April, people between 50 and 59 years old. Then on May, people 40 to 49 years old. And then from June to March 2022, the rest of the population. Next slide, please. Now I want to mention a special category that the government has established. That is the period between April and May 2021. It's for people between 50 and 59 years old, but also the government is going to contemplate people living with chronic diseases, such as the ones you're watching on screen. So probably it's gonna be really interesting, given that in Mexico the prevalence of diabetes, obesity, and hypertension is really big. So maybe the availability is going to be scarce at that time, as it is right now. So we should be really attention on that subject. Next, please. Now, the initial distribution plan contemplates only 2 states here in our country, which is Mexico City and Coahuila. The government has selected these 2 entities because they have really big infrastructure, military infrastructure, because the vaccine application is given at the military facilities in these 2 states, and the plan is for every vaccine to be given at a military facility throughout the country. Next slide, please. We have a really low number of vaccines coming in our country right now. It's really, we have to take into context that here in Mexico, we have 125 million person, and we haven't even got to the first million doses. So it's going to be really complicated. The procedure, once it's your turn to have your vaccine, is your arrival and appointment confirmation to the military facilities. You have a triage in case you are asymptomatic. Then you register. Then someone puts you the vaccine, and you have to stay in a 30-minute observation period before you are allowed to exit and go on to your activities. Next slide, please. The negative effects of the vaccine are really hard. We've seen collectively around 11 reactions for every million doses. And those reactions aren't serious. They are low-grade fever, myalgia, and perhaps just a bad day, but it resolves with acetaminophen for the next day. Now, how to get it, you might ask. Currently, it's not sold by the private sector because given that it has an emergency approval, it doesn't have an official registry for it to be commercialized. We don't know if it will be available later, but of course we're hoping it does. The local governments are going to make a registry of the population, a local registry and then it's going to be given to the national vaccination census to make a really structured plan. And for the USA, they have, I don't know if you know about this, but most of the vaccine require 2 doses. With the first one, you get around 50% efficacy and protection. And with the second dose, you go up to 95% of protection. Now, one plan for the USA, proposal rather, is the first dose first. This means that currently they are holding 2 doses per citizen to guarantee they are having their second dose guarantee. But the plan is to take those second doses that were reserved and just to apply it, because the logic of this is that it's more efficient to have more population protected with the 50% than just a small number of people protected with the 90% efficacy. So next slide, please. It may improve availability, but it's not a given. And now, as Dr. Cervantes mentioned at the beginning, you have to, our recommendation is that you should write a letter for the offices that you are watching on screen, and probably one of them should respond to you, since you have a rather big presence in our country, and you should be taken into account to get a vaccine here in Mexico, because so far what we know is that the national vaccination plan only takes into account Mexican citizens. So we're sure you can work something with the US Embassy, and they have you in their mind to protect their citizens living outside the United States. Next slide, please.
Ahí está ya, pero se está demorando. Safety of the Pfizer vaccine.
Okay, well, okay, there is safety of the Pfizer vaccine. Just as I mentioned, the 2-dose regimen confer 95% protection against COVID-19. These trials have been made on people 16 years of age or older. Currently, no one in the world is recommending individuals that are younger than 16 years of age to get a vaccine, because it's not being tried on them. So the safety of that population is remained to be seen. And the safety over an average of 2 months was similar to that of other viral vaccines. Now next slide, please. And before we move any forward, we want to make clear that getting the vaccine does not prevent you to get infected. The real use of the vaccine is for you to avoid any complication or any severe cases. Now, if you do have the vaccine and you get infected from COVID-19, what the vaccine is going to do is protect you to end up hospitalized or in the ICU, and it should confer you to a really mild case with just a low-grade fever and some respiratory discomfort, but it shouldn't be a serious case. Now, the Pfizer-BioNTech vaccine uses a new technology, which is called messenger RNA. It has mild to moderate side effect. The thing is, this is a really expensive vaccine. The price for the governments is about 20, and it's thought to have a price to the public at around $70. Also, the storage is really hard because you have to store it at minus 70 degrees Celsius, which is ultra frozen. So we don't have really an infrastructure or a system to have these temperatures. Now, what's really important for everyone here in a country like Mexico is the AstraZeneca vaccine. Now, this was developed with Oxford, and it has a great efficacy. Just like Doctora Alejandra Cortés mentioned previously, the vaccine we used internationally for the influenza has around a 60% efficacy. So this percentage from efficacy of the AstraZeneca vaccine is great news, because it uses the technology we all know and we have known for decades, and it's stored at regular fridge temperature. And the thing is that here in Mexico and Latin America, we should have better accessibility, because the Fundación Carlos Slim has made a really big effort to make it available for all the population. And maybe on the next weeks, we could start seeing tens of millions of doses being produced here in Mexico and distributed here in our country, which is great news. And particularly our hopes are put into this vaccine. Now, from Russia, you have the Sputnik 5 vaccine. Now, this has caused much controversy, because it's, you know, how governments like Russia that are rather authoritarian, they don't have a great deal of regulation with their own products. Now, they commercialized their vaccine as their first registered COVID-19 vaccine, and it can be stored at a temperature of +2 to 8 degrees. I mean, that's easy. It's really cheap. Just like the AstraZeneca, they are less than $10 each dose. But we should hold our thoughts for this vaccine, because we should wait for another international committee to really analyze their phase 3 trial, which is expected to end in May 21. So maybe with the Russian vaccine, we could wait before give any recommendations. And now what's really important, and it's taken really importance the last days, is the Chinese vaccine, which is called CanSino, the company that makes it, and the vaccine is called 85nCoV or Convidecia. This is a vaccine that has used countries like Mexico and Argentina and Brazil to make their clinical trials, because of the availability of the people willing to have that vaccine. This is a 1-dose vaccine, and currently it has been given to around 60,000 people. You can see on the left lower right corner that it has a clinical trial going on in the US. Because the US is really strict in protecting the population, their current participants are really a low number. So again, for this vaccine, maybe we can wait for the real results. Next slide, please. And talking about that, it's really concerning and it's interesting that our president, Andrés Manuel López Obrador, just yesterday, he said that the Chinese vaccine from CanSino is going to be for the elderly population here in our country. And he's going to reserve the Pfizer vaccine for the frontline health workers. So we don't really know. He swears that by March, every senior citizen here in Mexico is going to be vaccinated with the CanSino vaccine, but that remains to be seen. We have to wait for a really structured plan to be given out and to analyze it. And let's hope for the best. Let's see if this goes to a really actual plan. Next slide, please. Especially because you can move, it's really difficult to move older people to the military facilities. Now, a really brief explanation of the mRNA mechanism. This is the first of its kind to be authorized for public use. And what it does is mRNA is a set of instructions for the spike protein that Dr. Cortés mentioned at the beginning of our talk. Now, the instruction of the spike protein on the surface of the coronavirus virus, it's the key to infect our cell. Now, if we give our immune system the instructions to read out the spike protein, our body can identify that protein before it arrives to our body. Now, if we get infected and the spike protein does infect our cells already know how to identify it and it will destroy it immediately. At least that is the hope. Next slide, please. Now, for Mexico, the health ministry has 3 scenarios that they want to get as soon as possible. The first one is with 25 million people vaccinated. The second one is the 50 million people vaccinated, which is really difficult taking into account the Pfizer vaccine. But for the third scenario, in which the ultimate goal is to have a herd immunity, again, I mentioned the AstraZeneca vaccine is going to be key because of the storage capacity of that vaccine. We can get that vaccine to population that lives on really difficult conditions or in the mountains or underprivileged communities. So probably to get the scenario C of the herd immunity, the AstraZeneca vaccine is going to be really important for our country. Next, please. Now back to normal. Really protection from some vaccines can wane over time. Again, as Dr. Cortés mentioned earlier, on different clinical trials, the protection that we've seen lasts from around 3 to 9 months. But what we're seeing more and more is that probably this vaccine, this COVID-19 vaccine, is going to be the same as influenza, which we will have to take a boost every year for our immunity to be effective. And sometimes people don't get it because if they don't get all the shots, they can be protected like 50% and not 95%. So it's going to be a plan that we have to see. Next, please. Now, you may have some objections for not getting the vaccine for religious reasons, fears about the possible risks, and skepticism about the benefits. Now, as in Mexico, in the US, 70% of the population would have to recover from COVID-19 to stop the pandemic, and at the same time to achieve a herd immunity. But we are far, far, far from that point. So it's going to be a teamwork. So the new normal, we have to achieve a sustainable response. As I just mentioned before, face masks are going to be expected almost everywhere. You have to avoid crowds of people and small places and go into them only if necessary, just like public transport or some of that kind. And just like we are having right now, online events will replace social gatherings for at least the next year. Next, please.
So we are done, and we know questions by some of you. We all have these questions that are yet to be resolved by the Mexican government, but thank you very much, Victor. Thank you very much, Alejandra. The material that we have prepared for your group, we hope that it was useful, and we don't have all the answers, but this is what we could research for you guys to understand what's going on with the vaccination strategy.
All right. Thank you, Doctor. If you close your presentation now, we'll get back with Skip. Let me see if...
Okay, thank you, doctor and doctors, for the very, very informative presentation. For those of you that may have some questions, I know that we're running a little bit late, but we did have a lot of technical problems too from some hackers. So in the chat box, you can go ahead and type in some questions. In the meantime, Victor, if you're available, I had heard that for expats, if you have a permanent resident card, if you're a permanent resident, you're eligible to get the vaccine in Mexico. Have you heard anything about that? We have to unmute him.
Victor wants to be unmuted. Let me.
Yeah.
And Alejandra.
I would like Doctora Cortés to take it on. She has a way better response than I do.
Alejandra?
Yes, actually, I'm also a permanent resident. I'm not actually Mexican, so I have, kind of a similar situation, I guess. So far, I do not actually, I've not heard anything about what my situation is going to be like either. However, what I did start doing was that because I don't know how many of you have an IMSS insurance. So what I did was that in order to start preparing for it, I got one of the carnets. It's one of the things like you start getting prepared by getting this kind of paper that states where you're from, what your full name is, and you just have to present that in order to get, for instance, an appointment at one of the public health places, for instance, at one of the Unidades de Medicina Familiar. So I don't know yet if that is going to be a requirement, but most of the time when you go to a public health clinic, that is one of the things that they require of you. So if any of you have insurance from the government, I would encourage you to get one of those papers. It's through the Secretaría de Salud, the health ministry. So probably that is going to be one of the best steps that you could start taking right now in order to make sure that you have all of your papers in order if you're going to be doing this via the public healthcare way, and you don't want to wait around for the private sector to sell the vaccine.
Okay, I have a question here. If one were to get the Chinese vaccine, could we get a better vaccine later on? I guess that's assuming that the Chinese vaccine called, what is it called? Casino?
Yes, the company is called Cancino. And that's-
Cancino.
See.
All right.
Okay, so this is really important. If you get the Chinese vaccine, you cannot get other vaccines, at least for this year. And if you have the Pfizer vaccine, you can't get the AstraZeneca vaccine. And so you have to really commit to one vaccine. Maybe the next year, we don't know what's going to happen. We don't know if once you get this year a certain vaccine, you have to stay in that vaccine for the next years. But so far, for this stage, if you have some vaccine, you cannot interchange other brands.
Right.
Okay, we've got a couple of important questions here and comments. We have a very important group here in San Miguel de Allende that has been excellent in providing information for us as we've gone along. In one of its directors, Jessica Frick, has just mentioned that AMLO had a press conference 2 days ago in which he said that all residents, including extranjeros, are eligible for the vaccine because he wants that same reciprocity from other countries for Mexicans that are residents living in the US and in other countries, of course. So right now, there's going to be a lot of different opinions on this, and this might be a subject that we have to come back to. We also have a comment from Lee Carter, who is a Rotarian, and he was told that everyone with a corp is eligible for the vaccine. And Joey Merrifield also mentions that anyone with a permanent or temporary resident that has a corp can get the vaccine. So again, a lot of, I would say, controversy here. We'll have to find that out and get back to our members and all of those that are on the call. I think this will be very important for everyone.
Okay. Once again, when do you think that, well, first of all, I have a question. If we're going to go get the vaccine, if we're going to get it in Mexico, where in San Miguel is a military installation?
We don't know. We don't know the military facilities throughout the country, but probably we don't know if they're going to ask you to go to the Guanajuato and move from San Miguel de Allende to Guanajuato. Their I don't know, government building to transport you there to the military facilities. I mean, Alejandra has another take on this. Could you please?
Sorry. The thing about it is that right now, actually, one of the things that's happening is that precisely not everybody's close to a military facility. So even from right now, the doctors that are getting the vaccine are getting transported via buses. So most likely by the time that it gets to the general population, this is not going to be what is going to be employed. So we have to wait around for the situation to change in order to see how this is going to proceed. We hope that, as you say, it's not going to be a matter of taking everybody to a military facility, because it's also even exposing people, having them in a truck or in a bus all that time that it's going to take to get to the military facility. It is a risk in itself. So it's also something that you would have to actually take into account of whether you would get it that way or you would wait for the private sector to sell it, because it is also a risk to take in order to get to the military facility. So right now we don't really know how it is that the general population is going to receive it, but hopefully it's not going to be via the military facilities.
But it sounds to me that for right now, the vaccine is completely in the hands of the government.
Yes,
so you actually have to go to the government facility to even get the vaccination. You won't be able to go to
however, the private sector.
Go ahead. I lost you.
I think
believe he lost.
I think what he wanted to say was that I don't know if any of you saw the press conference where AMLO also said that he was going to allow the private sector
actually
to sell
skip
it.
the private.
Go ahead, Arturo.
Exactly.
I lost you. I didn't hear any of that.
In order for them to the availability.
Go on.
Arturo, you're cutting out. Your audio keeps cutting
To
out.
the private sector, just what Alejandra was.
I didn't catch any of that, and it sounded like it was very important. One of our members says that we do have a military facility here in San Miguel de Allende, out by the small airport. Although
Well, there is a federal installation just across from the theater in Hernandez Macias. That is a military installation, federal military installation. That is where the president who has visited San Miguel is staying overnight to be safe.
Right. Let me go back to the timeline on this because the majority of the people on this call, the overwhelming majority of the people on this call, maybe with the exception of Nori, are over the age of 60. So, and some even older. So anyhow, the question is, when is that going to be available for those of us over the age of 60?
I believe that we said in the presentation, I think it's going to be after February, if I'm not mistaken.
And Alejandra, how are we going to find out about that? I mean, how do we find out? What do we do? Where do we go? Where do we sign up?
So far, what we know is, as Víctor and Dr. Cervantes previously stated, that you should get in contact with the U.S. Embassy and also the Secretaría de Salud, or both from Guanajuato and the federal one, so the Ministry of Health. So we're going to work in getting you those contacts for you to do that. But the quickest way that we can think of is that you get directly in contact with the government, because especially since you are a very big group, then maybe you will be able to get some kind of I don't know, like a special day for you to go, or I'm not sure how they would go about it, but since you are U.S. citizens, then I imagine that there is something that could be done as soon as you get in contact with the governments. However, we do advise that you do it as quick as possible, because as you know, there is going to be a transition in the White House. So we don't want any miscommunication to occur. So perhaps you should get in contact with both the current White House and the transition team from Joe Biden in order to get to tackle the most amount of people, in order to get these pressing questions out of the way.
I have a question for, and I don't mean to put her on the spot, but Joey Merrifield is on this call. And Joey, if you could unmute, do you think that you might be able to communicate information for expats once you find out? Because I know you're staying on top of this stuff.
Sure, I'd be happy to. I'm in talks. I think people probably know I'm also a community liaison volunteer with the U.S. Embassy, and as is Terry Kavanaugh, by the way, and several other people that may be on this call. And we're in close communication, multiple WhatsApps a day. And as I and Terry and other people get info, I've been posting to my Facebook page, or and we can also post to the civil list as well.
Right. Okay. That would be most helpful. And if you could, well, of course, if Terry's on the call too, I believe,
Yes.
just communicate that through the, through the Rotary Club. We can get it out to a lot of people as well, because it's very, very important information. And obviously, the sooner that we all can get vaccinated, the better off we're all going to be, and we'll be able to return to our wonderful lives in San Miguel de Allende. Okay, let's see if we have any more questions. I'm sure we do.
There's
Oh.
a couple of comments. One is, has anyone established, the length of time that the vaccine will be good for? I'm sure there's a lot of questions that are still unanswered. There are a lot of questions that are posted for everyone, and coming in. Not sure that they're coming in from people that are really authority on the subject, but I do believe that there are some things that no one here yet knows because they're still, in the works of finding out all of the particulars. Let's see.
Just
What
to
else?
get a little bit to kind of answer that question as far as we can. Again, we don't really know how long the vaccine will be good for. For instance, the influenza vaccine is only good for 1 year. So far, what we have to figure out is that we can only figure out once we start applying the vaccine is how long it will last and how often we're going to have to reapply it, because it is kind of it is highly likely that we will have to reapply it regularly, because as I mentioned previously in the presentation, certain research has found out that they don't really, the antibodies, which is what gives us our immunity against the disease and getting reinfected, don't really last. So that is why we are hearing cases of reinfection. So that is one of the, if we are seeing that our body naturally doesn't sustain these antibodies for long, it's highly likely as well that the vaccine won't last for that long. And also because of the new mutations, we have to see if we're going to have to make another vaccine that is going to tackle these mutations, or if that won't be necessary.
There's also an important message here from Joey Merrifield explaining that many acquaintances or people that we know are falling prey to rumors about things that they can take if they get COVID. Like the popular topic right now is chloro water. And obviously this is something that is false. And so I think that we all have a responsibility to guide people to reputable sources of information and to places that they can get actual information. And the more we dispel these kinds of rumors, the safer the community will be.
All right.
Yes.
Alejandra, there's been a couple questions about the paper that you mentioned earlier in your presentation that could be obtained from the Ministry of Health. What was the name of that paper?
The paper from the Ministry of Health?
Someone has asked whether you could repeat that, so I don't remember.
The name of the paper.
When you were speaking about ease.
It's called Carnet. I actually have the link. If you can give me a little while, I can get the link that I used, the Carnet, in order to get it. So I'm going to put it in the chat as soon as I have it.
Someone is asking for Joey Merrifield's email. So if that's an open thing,
I'm not
we
handing
can
out
either
emails.
respond to the person directly or openly. So anyone that's working with Joey can respond to that.
Joey has it on her photo.
Okay, wonderful. Thank you.
Okay. Does anybody have any more questions? Because we are about to adjourn, running a little bit late, but that's okay because of the importance of what we're talking about. Does anybody, Doctor or Alejandra, can you discuss the ivermectin protocol that a lot of people are talking about as a therapeutic, as prophylactic to COVID-19?
Actually, so far, I know that a lot of people still keep prescribing it. So far, as per the CDC as well, there's really no evidence that it's beneficial. So it isn't going, it has minimal side effects. It's not really a dangerous thing to take. It's actually something that you take when you have lice in your hair, for instance. So it's not really something that that is harmful to you. However, I would say that it is an unnecessary drug to take because there's no evidence that it's going to help you either prevent the disease or make the disease better. So I don't actually, there was a lot of talk about that at the beginning, but again, there are no actually conclusive studies that say that there is any benefit to those. So if you want, you can stop taking them. If you don't want to, nothing's going to happen to you if you keep taking it.
What about dexamethasone?
Dexamethasone, it's a corticosteroid. It's basically a drug that is trying to keep your immune system kind of dormant. One of the reasons why they would say that you should take it is because precisely one of the things that the COVID-19 virus does is that it hypes up, so to say, your immune system. So in order to prevent that overwhelming reaction, then they want to keep it dormant, so to say. But there's really no, I would really advise against doing that as a preventive method, because also, okay, so it's going to stop you from getting COVID-19, but it could also make it easier for you to get bacterial infections, like for instance, pneumonia and other kinds of diseases. So I would advise as well against using that, especially if your doctor has not prescribed it.
If you have a patient that has COVID-19, what are you using to treat them with?
One of the things that we mentioned was the monoclonal antibody that has emerged so far. Right. I haven't seen news of it arriving at the Mexican market, but it's something that is meant to be used at the home setting. It's not meant to be used for the hospital. For the COVID-19, it's very symptomatic. If you have a fever, you can treat it with Tilex, for instance. If you have a cough, you can take cough drops. It's all you see a problem and you manage it. It's not meant to, you're not meant to be buying oxygen. You're not meant to be buying, if you were worried about it, then if you start feeling, for instance, that you're lacking air to breathe, if you feel extremely tired, or if your headache just won't go away, I would advise going to the emergency room, for instance.
And finally, one question: would you bet on a vaccine called Casino?
I think that
it's Cancino with a C-A-N.
I know, and I'm just kind of joking.
It's Cancino, but I think mostly we have to see what the studies say. I think that for the medical community, the Chinese have made a lot of incredible contributions. It's also something that I know that people are going to be very reluctant to trust in so readily, especially because the pandemic originated in China. But it's also something that we cannot look at it through our emotional side of wanting that, but we have to see it objectively. And as soon as we have studies backing up or saying that we shouldn't use that vaccine, then I do think that it's the right way to go.
All right. We're going to have to wrap it up. It's going on 11 o'clock. And I want to thank all of you for joining us, Alejandra and Dr. Cervantes, and I think everybody
Dr. Victor, all the doctors, thank you so much.
Thank you for being here. I appreciate it.